is Victoria, and I'm going to be doing your physical exam today. Can you tell me your name?
Brad Peterson.
Can you tell me your age?
29.
Where are you?
Ferndale, Michigan.
And then can you tell me what month it is?
February.
Okay. He is ANO times 3. He appears well nourished and well groomed. There are no obvious physical deformities. He is sitting in an upright position. He is pleasant, attentive, and his speech is clear. His general skin assessment, there are no obvious deformities, no skin lesions, no bruising. I'm going to inspect your head. His head size and shape are normal and in proportion to his body build. There are no obvious abnormalities. I'm going to feel your scalp. He has even hair distribution. There are no lesions or bumps. Can you clench your teeth for me? Can you stick out your tongue? Okay. I'm going to palpate your sinuses, and I want you to tell me if there's any pain or tenderness.
No.
So there's no tenderness or bogginess noted. I'm going to inspect your eyes now. His eyebrows and his eyelashes are present and intact. He does have a scar underneath his left eye. I'm going to take a look at your conjunctiva. It is pink and moist, and his sclera is white. I'm going to now test your corneal reflexes. I'm going to come in on your left side here with this light. Just take a look at me. I'm going to watch for your pupil constriction, and then for your right pupil constriction, and then I'm going to do the other side. Both eyes constrict consensually. I'm going to test your 6 cardinal gazes, so watch my pen light and keep your head still for me, okay? Good. Okay. Good. Okay. His pupils are round. They are reactive to light. They accommodate. And they are about 3 millimeters in size. I'm going to test your near vision. I'm going to give you this. Hold it 12 inches away and cover your right eye. And then read the first 2 lines, please.
DT4LES3.
And then cover your left eye. And then read the first 2 lines.
DT4LES3.
Good. Okay. I'm inspecting his ears. I'm looking at his external ear structures. There are no obvious abnormalities or piercings, no lesions. Both are symmetric. I'm going to palpate his external ear, the auricle here, and the tragus. Any pain or tenderness?
No.
Good. Okay. I'm inspecting his nose. It is symmetric and is placed in the middle of his face. I'm going to cover one nostril here. Take a deep breath in and out. Other side. Okay. His nasal airways are intact and patent. I'm inspecting his lips. They are pink and moist, no impairments. Can you open your mouth for me? All right. I'm going to shine a light. Say ah. Tonsils are 2+. His uvula is in the middle, and it moves appropriately when he's vocal. I'm observing his neck. There are no abnormalities. I'm going to test your range of motion of your neck. Can you tilt your head up for me? And then tilt your head down. Tilt it to the left, and then tilt it to the right. Is there any pain or tenderness?
No.
Okay. I'm going to have you lean your head on my hand, and then the other side. Okay, I'm going to put my hands on your shoulders and then shrug for me. Okay. He has equal strength bilaterally in both his shoulders and his neck. I'm going to palpate your lymph nodes now, and I want you to tell me if there's any pain or tenderness. Preauricular,
No.
postauricular,
No.
occipital,
No.
posterior cervical,
No.
anterior cervical,
No.
tonsillar,
No.
submandibular,
No.
submental,
No.
okay, and then supraclavicular.
No.
Okay, his lymph nodes are fully mobile, they are non-tender, and there's no swelling noted. Okay, I'm going to palpate your carotid pulses now. It is 2+ bilaterally, and his trachea is midline. I'm inspecting his chest. Can you just turn for me, please? I'm taking a look at his posterior side. There is no obvious respiratory distress. There are no abnormalities noted. I'm going to check your chest expansion. Can you take a deep breath? There is bilateral chest expansion. I'm going to put my hand on your back, and I'm checking for tactile fremitus, and I'm go ahead and say 99 every time.
99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99. 99.
All are within normal limits. I'm now going to percuss his posterior chest. There is no dullness or tympany. I'm checking his CVA tenderness now. I'm going to put my hand on your back. I'm going to give you a tap, and I want you to tell me if it hurts.
No.
Okay? This other side.
No.
There is no pain noted. I'm going to auscultate your breath sounds now. Deep breath. Breath sounds are clear bilaterally on the posterior side. Go ahead and face me. Alright, I'm going to auscultate your anterior chest now. Take a deep breath. Breath sounds are clear anteriorly with equal air exchange. I'm inspecting his anterior chest now. There is no respiratory distress when he's breathing. He has unlabored breathing and equal lung expansion. There are no deformities observed. I'm inspecting his precordium now. I see no deformities and no abnormal pulsations. I'm going to find his apical pulse, left midclavicular line, and then the 5th intercostal space about here. Okay, I'm going to listen to your heart sounds. Okay, I'm going to do the bell side now. has a regular heart rhythm and rate. No murmurs heard. I'm going to feel your upper extremities. I'm going to start with your shoulders, and then move down to your elbows and your hands. I see no deformities, except he has a scar on his left pinky. I'm going to palpate your capillary refill. It is less than 3 seconds, and he has pink nail beds. I'm going to palpate your radial pulses now. Pulses are 2+ bilaterally. I'm going to test your range of motion of your upper extremities. Put your arms out for me, and then put them up, to the sides, and then down. Okay, he has equal range of motion without any limitations. I'm going to go ahead and have you lay down. Okay, I'm inspecting his abdomen. It's soft and flat, and no abnormalities. I'm going to auscultate his bowel sounds, starting at the right lower quadrant. Bowel sounds are present in all 4 quadrants, and I'm going to listen for to his aorta with my bell. Okay. And then I'm going to percuss his abdomen. All with the normal limits, and I'm going to lightly palpate now. Do you feel any pain?
No.
Any tenderness?
No.
Okay, and now I'm going to do deep palpation. Are you hurting?
No.
No masses or bulges. And I did hear bruise in the aorta. I'm taking a look at his legs. No abnormalities, no impairments. Feeling his dorsalis pedis, 2+ equal bilaterally, and then posterior tibialis. It is 2+ equal bilaterally. Now I'm going to test his range of motion. Lift your leg up for me. Bend it. Adduct. Abduct. Straighten your leg out. And down. Other side. Up. And then bend it. And then towards the middle. Abduct. Straighten it out. And then down. Good. Any pain?
No.
So he has equal range of motion without any limitations and no pain. Go ahead and sit back in the chair for me. I'm going to be doing your neurologic assessment now. I'm going to have you close your eyes, and I'm going to touch you with this Q-tip, and I want you to tell me where you feel it.
Right cheek. Left cheek. Left arm. Right arm. Right arm. Left arm. Left hand. Right hand. Right leg. Left leg. Left leg. Right leg. Right foot. Left foot.
Good. He is able to determine superficial touch. I'm going to assess his cerebellar function. Put your hands out for me. Hold a bowl of soup and then flip it over. Good. Can you put your heel to your shin and then run your heel down? Good. And then on the other side. He displays coordinated movements bilaterally. I'm going to test your reflexes now. So go ahead and just relax for me. I'm going to do your brachial reflexes first. Okay, patellar reflex. And then flex your foot for me for the Achilles. And then plantar reflex. Sorry. All reflexes are intact and within normal limits. Go ahead and stand up for me. I'm going to move this chair. Can you walk towards the door? And then walk back towards me with your heels and touching your toes. Good. Your gait is normal. Stop right there. And then, yep, stand right there. Close your eyes for me. Put your feet together. Put your arms out. Sorry. Lift one leg. And then put it down. And then your other leg. Good. Balance is good. You can open your eyes. I'm going to test your range of motion on your back. Bend forward. Bend backwards. Bend side to side. The other side. And then twist. Any pain?
No.
So he has equal range of motion, no pain noted. And that finishes up the physical exam. Thanks, Bradley.